So, good morning. So today we are going to start with a new topic that is, and a very important topic also, not just new, is on your examination paper. Might be a good question for the examiner to ask. So we are going to discuss this topic. So the topic is Women and Children's Welfare Scheme in India, which all are the schemes which the government has, come up with for women and children. These all we are going to deal or discuss in this class. For the social and economic development of the women, the Center has set up the Department of Women and Child's Development, which has been implementing the following schemes. So, for social economical development of women, the central government has set up departments for women and children so that they could develop and they would get help from the government side to develop. And for those, all those departments have set some sort of schemes. So we are going to see each scheme one by one. So the very first scheme is Swayam Siddha. So Swayam Siddha is an integrated scheme for the development and empowerment of women through self-help group. It covers services, access to micro credit, and promote micro enterprises. So basically, what happens? What is Swayam Siddha scheme is about? It is for basically it's for women, and it helps the women to work in a group, and they can start up their own business, or they small group, small group of women, and covers microcredit, means the government also provides some sort of fund also, which is the micro, which is termed as microcredit, because the amount is not very large, because it's for the startup companies, and the government provides some amount, but not a very large amount. But yes, definitely it's government's going to provide some sort of amount which will help the women to set up their business or their enterprises. So this is about the Swan Siddha scheme. Swasakti project. Second project is Susakti project. Swasakti project. The Susakti project aims at increasing women's access to resources for the better quality of life through the use of time reduction devices, by providing health and education services, and by imparting skills to women for income generating activities. So in Sushakti project is yes. In the Sushakti project, as the name itself suggests, this is a Sanskrit word, and it means self empowerment. So it helps the women for self empowerment. So in this under this scheme, the government provides women resources for better quality of life through the use of reduction devices. The government provide better form of devices, and or the money, or the you know fund for those devices, so that the time which is required will be reduced. Say if a woman is sewing a cloth, and if she is doing it with the help of a needle and thread just by her hand, it will take her a lot more time than that of if the woman does it does does the same thing with the help of a machine. So sewing sewing machine. So like this, a lot of things which makes the life of women easy. The government provides funds for those things, like a small paper making company. It's tough for women to make a number of proper. It's not tough actually. It takes time. Time consuming. I must correct myself. Actually, time consuming for women to prepare each and every paper from their pan. So for these things also, the government provides a bit of fund to the women so that they could purchase a device which you know saves their time, and they through this project provide the government provides health education also, like health facilities, education services also, and they provide skills. If women want to develop a skill, then they can impart skill to women for income generating activities also, so that the women could stand on their feet. So this was about Swasakti project. Swas, Swasakti project. It's a bit tongue twist. Anyways, the third topic is child development services. The scheme started. This child development service scheme was started in 1975 with the objective of giving special coverage to slum in urban areas. So basically, this scheme was for those children who are living in slum areas of urban areas, means the slum of urban areas. Children who belongs from slum of urban areas. This child development service is for those children. The scheme also envisage the delivery of an integrated package of services consisting of immunization, health checkups, nutrition, health education, refreshment services, children's and training. So this child development service includes providing immunization services to these slum area children, health checkup for them, free health checkup, nutrition checkup and nutritional diets for them, health education for them, refreshment services to children and pregnant women also. So this is about child development service. And next we're moving towards support to training and employment program for women. So it provides new skills and knowledge to poor women in agriculture, animal husbandry, dairy, fisheries, sericulture, handlooms, handicraft, and khadi and village industry sector of employment. So based on this scheme, which is termed as support to training and employment program for women, this scheme provides new skills and knowledge to the poor women which are attached or which are earning their livelihood through agriculture, animal husbandry, dairy, fisheries, sericulture. Sericulture means the silk production industry, okay? Handlooms, handicraft, and khadi, and village industry sector of employment. So for all these people who are still attached to the ground source of income, the government is providing skills to them, new skills, so that their production may increase and their time may they would require less time and knowledge to the children to the women. So the next project is Swavalamban. So the next project is Swavalamban. This scheme provides training and skill to women to enable them to obtain employment or become self-employed. The trades in which training is imparted includes computer programming, medical transcriptions, electronic assembling, electron electronics, radio and television repair, garment making, handloom weaving, handicraft, secretarial practice, embroidery, and community health. So this scheme provides training to the women and to enable them or to make them sufficient so that they could obtain employment or they could get an employment and develop a self-employment. Okay, so all the skills or the trainings which comes under this skill are computer programming, medical transcriptions, electronic assembling, electronics, radio and television repairs, garment making, handloom weaving, handicrafts, secretarial practice, embroidery, community health. These all training and skills are included in Swalambham Swalambham 1 Swalambham project or scheme. Next is crutch or daycare centers for the children of working and ailing mothers. It aims at providing daycare services to children of the age group from 0 to 5 years of parents whose income does not exceed 1,800 per month. The service includes sleeping and daycare facilities, recreation, supplementary nutrition, immunization, and medicine. So this is a this is a scheme from the government side for women that they can keep those women who are earning, who are working, run their family, and cannot earn more than 1,800 rupees per month. They, the government is providing the facilities that they can leave their children of the age group from 0 to 5 years at the crutch or daycare center, and these daycare centers are opened by the government. The government personnel will provide facility or services to the students, to the children. All the services includes are sleeping, daycare facilities, recreation, supplementary nutrition. Nutrition will be also given, immunization, and medicine. Next is hostels for working women. Under this scheme, financial assistance is provided for the construction and expansion of hostel building for working women. It also includes provision for safe and affordable accommodation to women, working women, single or married, those getting trained for employment, and girl students studying in professional courses. So this is also a very good step from the government side for women. Under this scheme, the single women or the married women, those who are working or you know undergoing for any sort of professional courses can live there, and the government has tried to provide safe and affordable accommodation to the working women. Next comes the Swadhar. Swadhar. This scheme provides integrated service to women without support from their families, such as widow living at Vrindavan, Kashi, pensioners released from jail, survivors of natural calamities, women's children rescued from brothels and other places, victims of sexual crimes, etc. The scheme includes such services as food, clothing, shelter, healthcare, counseling, legal aid, and rehabilitation through educational awareness, skill formation, and behavioral training. So, based on this scheme, Swadhar, this provides integrated service to women without support from their families. Those women who don't get any sort of support from their families, like widow women who are living in Vrindavan and Kashi, pensioner released from jail, those women who were in jail and now they're outside and they getting pensions, survivors of natural calamities who don't have any family, like they are the only survival. women or girls rescued from brothels and other places, victims of sexual crimes. These all women get Aadhaar service from the government side, and this scheme includes services such as food, free food, clothing, shelter, healthcare, counseling, and legal aids and rehabilitation to education awareness, skill formation, and behavioral training for the women. Next scheme is Rashtriya Mahila Kosh. The National Credit Fund for Women is meant to facilitate credit support or microfinance for women to start such income generating schemes as agriculture, dairying, shopkeeping, vending, and handicraft. So this National Credit Fund for Women, this Rashtriya Mahila Kosh is a national credit fund for women which provides credit support to the women or microfinance, small amount of finance to the student, to the poor women, not students, the poor women who want to start income generation scheme like agriculture, dairy, housekeeping, vending, handicraft, small businesses which they want to start. This Rashtriya Mahila Kosh helps in that. Welfare of street children with the objective of weaning away street children from a life of deprivation and vagrancy and rehabilitating them. An integrated program for street children is being implemented with a wide range of initiatives like 24 hours drop-in shelter, night shelters, nutrition, healthcare, sanitation, hygiene, safe drinking water, education, recreational facilities, and protection against abuse and exploitation. This welfare of street children is for those children who are living in street जो बच्चे सड़क पे रहते हैं उनके लिए है and the objective of this welfare of street children this scheme is to you know that no child should live in a street. The main objective of this welfare is to rehabilitate these kind of children who are living in the street, don't have any facilities. An integrated program for street children is being implemented with a wide range of initiatives like 24 hours drop-in shelter. मतलब जैसे कि इस प्रोग्राम के अंदर it's being that as soon as any children is found on the street alone, then these children should be dropped within 24 hours in the shelter or should be kept in night shelter if they are found at the time of night. Nutrition should be given to the children, healthcare facilities should be there, sanitation, hygiene, safe drinking water, education, and recreational facilities should be provided to the children, protecting against abuse and exploitation. And the measures should be taken to protect these children against abuse and exploitation also. So these are the schemes from the government of India for women's and children welfare. And in the next class, we are going to see the child welfare. Topic will be child welfare, and under which we will see the rights of children, relation of women and children, relation of women and child welfare with the environment, the diagnosis of common childhood disease condition, complaints, and symptoms. These all are the topics which we are going to cover tomorrow. And for today's, that's it for the class.